Hi, my name is Ruth, and my presentation is on Cerumen Impaction. So, what is cerumen? Cerumen is also known as earwax. It is caused by an accumulation of earwax in the external ear canal, and it starts causing symptoms such as hearing loss, pain, itchiness, tinnitus, or also it can prevent the healthcare professional from being able to look into the ear and look at the tympanic membrane. So those are some of the symptoms. And how does cerumen impaction happen? Well, cerumen is supposed to be a good thing. It's supposed to be a source of protection from water, infection, and foreign bodies to the ear canal. When the cerumen is formed, it's formed by these glands. It's the sebaceous and the ceruminous glands, and they are found in the external ear canal. These secretions are then mixed with dead skin layer and bacteria, and this is what altogether forms the cerumen or earwax. Earwax is usually removed with jaw movements, so it should naturally be excreted from the ear. But if it's not removed, then there's a high chance of causing the cerumen impaction and causing those symptoms that I've mentioned before, which were itchiness, loss of hearing, or tinnitus. These are the 5 key actions that I found in the clinical practice guidelines. They are to once see if the patient are having symptoms, see if they're having any hear loss or ear pain, itchiness or dizziness. And you also want to determine if the patient is able to verbalize the symptoms. For example, little children, they can't tell you those symptoms. They don't have the vocabulary, or adults who are with cognitive impairments such as patients with dementia, they're not able to tell you. So you want to determine those kind of patients, and then you also want to remove them if they're not able to express them or if they are having symptoms. And the 3 types of removal methods are medications, which are called cerumenolytics, or irrigation or manual removal. And you also want to reassess them or refer them to an ear specialist. You want to refer these kind of patients. There are chronic cerumen impactions, people who are constantly getting them, perforated tympanic membrane, necrotic tissue in the ear canal, or patients who are constantly having complaints even after the cerumen was removed. You also want to educate these patients on how to keep the ear clean. One of the methods that was on the website in the journal was to use a cotton ball dipped in mineral oil and place it on the external ear canal up to 20 minutes, and you would do this 1 time per week. So the clinical practice guidelines that I just talked about in the previous slide was from American Academy of Otolaryngology Head and Neck Surgery Foundation. It was originally written in 2008, but it was updated in 2017, and that was the version that I used to come up with the 5 key actions. And according to UpToDate, that was written in 2021, these are some of the reasons why it's important to know about cerumen impaction, because it affects 6% of the general population. There's a higher percentage in people with cognitive impairment who has cerumen impaction. There's 1 in 10 children that are seen with it, 1 in 20 adults, 1 in 3 older adults. There are 12 million patient visits and 8 million cerumen removal procedures that are done annually. So it's not a rare case. You will see it. I saw it a few times in my clinical rotation as well. And that leads us to our next slide. A patient from my clinical one of the patients that I saw who had Cerumen Impaction was a 7-year-old girl, and she had it in just one of her ears, in her right ear. And the diagnosis was made by using the otoscope, and when I looked in her ear, it was a complete blockage. It was just this black color, and I couldn't see anything past it. And for us, we weren't able to treat this patient because for her, she had a higher priority, and that was to reduce her high fever. She had a fever of 103, so that was our top priority. And when the patient was asked about having any symptoms, and she said no to everything, and so what we did for her was help treat the fever and then give her and her mom education on how to clean out the ear. And we also gave her some list of specialties, ear specialists that they can go to if they need to. So that is what we did. And this last page is the reference page. So I got all of my information from UpToDate and from the journal that was from the American Academy of Otolaryngology. I'm sorry. So this is the end of my presentation, and I hope you enjoyed it. Thank you.